Does this video provide factual proof that COVID-19 vaccines interfere with human reproduction, cause cancer and are ineffective? No, that's not true. Peer-reviewed and evidence-based information from qualified scientists has disproved those claims, which are made using faulty data and by reference to anecdotal information that would not pass muster as the basis for consequential public health decision-making, which relies on peer-reviewed and published reports from field work. The claims appeared in a February 19, 2022, Facebook video, published on the Grandmaster of Discernment 2 Facebook account under the title, "Listen Carefully." It opened, quote, "Listen closely to Dr. Robert Malone and Dr. Rainer Fuellmich as they give alarming data points and explain why indemnification laws won't shield Big Pharma. We have in all." End quote. This is what the post looked like on Facebook at the time of writing. Source: Facebook screenshot taken on WED February 23, 21 hours 49 minutes and 49 seconds 2022 UTC. The video consists of German trial lawyer Rainer Fuellmich interviewing Robert Malone, MD, a medical researcher and biochemist who contributed early research into mRNA vaccines, about their efforts to punish public health agencies for vaccinating people against COVID. Both men are leading anti-vaccine activists whose prior statements have been fact-checked by lead stories. False claim. Department of Defense data prove COVID vaccines increase the risk of cancer at the 0.25 mark of the video, Malone declares. Quote, "So, we do have these data from DoD which are aligned with the data from Ryan Cole suggesting that the cancer risk signal is real." End quote. Lead Stories investigated, and found discredited evidence for, a claim that COVID vaccination led to skyrocketing rates of miscarriage, cancer and neurological disorders were proven in the Defense Medical Epidemiology database. The Department of Defense, DoD, had identified that underreporting in prior years had made a spike in 2021 data, when reports were dutifully filed during the COVID vaccination campaign. A Pentagon spokesperson told Lead Stories the data had been taken offline while DoD staff seek to identify and correct the root cause of the data corruption. Malone appears to be referring to Dr. Ryan Cole, who runs a medical testing lab near Boise, Idaho. Cole led opposition to COVID vaccination during that state's late 2021 surge in cases. Cole is board-certified in dermatopathology, a medical specialty in which doctors are trained to do the lab work and analysis dermatologists and other specialists require for treatment of cancer. Cole is often described as Mayo Clinic trained, but the famed Minnesota Medical Center distanced itself from Cole's anti-COVID vaccine claims in a September 21, 2021, email to Lead Stories, when Mayo spokesman Bob Nellis wrote, quote, "Mayo Clinic is aware of claims made by Dr. Ryan Cole regarding vaccines. Dr. Cole was trained at Mayo Clinic but is not a Mayo Clinic employee. His views do not represent Mayo Clinic." End quote. Cole's anecdote-based claims, including that COVID vaccines have caused a 20-fold increase in endometrial cancers, stand in direct contrast to the findings of studies of the effectiveness and safety of COVID vaccines as published in peer-reviewed journals of science. There is no published research by Cole found in the National Library of Medicine, which draws on an index of more than 1 million science titles. False claim. COVID vaccines pose a risk to reproductive function. Summarizing what he says are problems with COVID vaccines, Malone goes on, at the 110 mark to say, quote, "The reproductive risk being a real event and that would potentially have implications all the way down to the children. So the risks, back to that with the DoD data, so we have the reproductive risks." End quote. Malone has made this claim before, saying that the spike protein generated by the mRNA vaccines is toxic and causes permanent damage to vital organs, including the reproductive system. Not true, says Professor Deborah Fuller, a PhD microbiologist who runs a vaccine research lab at the University of Washington. The lab has worked on COVID-19 vaccine development since the first major U.S. outbreak, in Seattle, in 2020. In a January 27, 2022, email responding to Lead Stories questions, Fuller wrote, quote, "There is no evidence that the minuscule amount of spike protein produced by the mRNA vaccines is toxic. In fact, the studies that have been done to date show that only very Very small amounts are produced and rapidly eliminated from the body. The way the vaccine works is the protein is transiently expressed in the cells that the mRNA vaccine is delivered into, and then the protein quickly disappears after initiating the immune response. End quote.